Okay. Coding looks good.
Rock and roll.
Yeah, it looks good. We're on good on LinkedIn, Facebook, Instagram, YouTube, Twitch. All right. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and tonight we are joined by Dr Ahmad Al-Hassiny. Having graduated from the University of Otago with first class honours in 2015, being awarded many clinical and research prizes, he has continued his pursuit of excellence in dentistry. He has first-hand through his own work how CAD/CAM and digital dentistry can positively change daily dental practice. He's carried out many aspects of complex digital dentistry, including CAD/CAM full mouth rehabilitation, digital smile design, all in-house. He's one of the few in the world who owns and has tested all mainstream scanners and CAD/CAM systems in his clinic. He is also the director of the Institute of Digital Dentistry, IDD, which is a world-leading digital dentistry educational provider. Dr. Ahmad Al-Hassiny, welcome to the show.
Thanks, mate. It's good to be here.
So, tell us about your CPD or dental journey so far.
Well, a lot of my CPD journey is obviously focused around digital. I mean, that's really my passion. But like a lot of people, when I first started out, I got out from dental school and you quickly realize you don't actually know a lot. So I was just consuming as much CPD as I could in those first years. And this ranged from, like the basics of like endo CPD, surgery CPD and those sort of things. And back then it was much easier times. You could actually travel and do things overseas. Now we're a bit limited. But I would say in the past three years, it's really focused on digital dentistry, and mainly a mixture of self-taught and just following those who basically you can view as mentors.
So you're saying very early on, you're kind of just trying to get into the thick of the bread and butter dentistry that you were kind of going to come into as well. So what were some of these ones that you mentioned you went overseas for it? You mean like to Australia, or you mean in New Zealand?
I was actually a bit further. I would say one bit of CPD that really changed my whole career. It's a implant course out of all things. And it was held in Peru. It's the one run by BioHorizons over there.
Mm-hmm.
And the funny thing about it wasn't that it changed my career because I started doing implants, but like a lot of new grads, I was just crazy scared of surgery. I mean, I would refer a lot of wisdom teeth. I wouldn't do a hell of a lot. And just being, hands-on in a relatively safe space with a lot of support around you and just learning the fundamentals of just cutting flaps and suturing flaps, that probably was the one bit of CPD that changed my career the most, because once you learn those fundamentals of surgery, I mean, yes, that was an implant setting, but then it opens up a whole range of different things you can do. You're all of a sudden more confident to take out wisdom teeth, because at the time I was doing a lot of extractions, but for some reason, something about wisdom teeth, opening flaps and stitching them closed just freaked me out. So
right, so you're learning this bread and butter, and so when does you decide to go and take your the jump into implant?
I would have probably been about 2 to 3 years in. I was quite fortunate as well that I work alongside my father, and he's a very capable dentist. He's, I would consider him easily one of the top in the country. And so he was doing a lot of implants, and I obviously had the support there. And to be honest, the reason why I did that course was for the surgical skills more than anything. It wasn't actually really to do implants, because, I mean, a lot of people will tell you case selection is key, but placing an implant itself, the process of putting an implant in, isn't actually that complicated. I mean, drill a hole, you can put it in. But the key really is all the surgical skills around putting the implant in. That's really what separates it all. And I was just finding myself struggling with, like I said, raising flaps and stitching up gums. You don't get much experience in dental school.
Mm.
And that's why I gravitated towards this course, because they promise you would, do it about 20 times in the span of 4 days. And I was like, look, that sounds pretty good.
Right. And so when that kind of happens, so you're going through that, so now you're feeling more confident in it. And at the same time, you're still kind of doing some of these local kind of courses, CPD courses, to kind of still supplement it, all of that. And then how do you kind of incorporate, your full mouth aspects of things?
That really came from the digital side. Like, I was trying to learn as much as possible. I'm one of those general dentists that really like to do it all, from orthodontics to implants to surgery to endodontics, and the digital aspect is this other thing on the side, really, that I was also learning during all of this. Again, I was really fortunate. I went into a practice that had a CEREC, it had a trios. And so the last time I really did an impression for Crown and Bridge was dental school. So as a follow-up from going from single crown to full mouth rehab, it was basically about 3 or 4 years of just ongoing learning and things like, there's a lot of really good full mouth rehab courses now online. The one I particularly liked was Phelan. It's run by Phelan. It's a really comprehensive. And although a lot of it is analog, you could apply a lot of these things to a digital workflow. And it's funny. I mean, full mouth rehab is also one of those things that freaks a lot of people out. But it's all about case selection and good planning. Because if I give you a perfect wax up that's fit for the patient's mouth and is fit for CR and everything, cutting one crown versus cutting 14, the skill gap, the stress increases, don't get me wrong, but it's all cutting crowns. The point isn't the cutting crowns part, it's all the planning, understanding what you're doing beforehand.
Yeah. And would you say that particular course was a game changer? Would you say that what in particular about that course compared to maybe something or the other courses that stood out more?
Phelan's course is an interesting one. The thing that stood out to me was it was actually online. I have affinity for online courses. I mean, it's one of those things that I think we've all warmed up to, that we can actually learn things online and we can actually learn things through videos. And for his thing, it just attracted me that it was a one-time thing, and he sent you all these DVDs, and I'd consumed some of his content before, and the guy is comprehensive as anything. I mean, it's like it's pretty hard to get through the first time. But over a few months, you kind of digest all the information, and it fundamentally is quite sound.
Right. Yeah. And
so
so
a lot of it's like basic things, like what a leaf gauge is, how to use a leaf gauge, how far to open up a patient, and from there you can translate a lot of these things to the digital workflow, which makes things even easier because no one likes to take impressions of 14 crowns, but scanning 14 crowns is much easier.
Yeah. Okay, so you're going through the bread and butter, you're doing your implants to get better at surgical skills, and then at the same time, you're slowly building up this full mouth rehab kind of education around that. And then how do you incorporate digital smile design? Where does that kind of come into your CPD?
Perfect. I mean, digital smile design, again, is one of those things. I couldn't say it was a specific course. I mean, DSD is all around us now. So many people are teaching it online and everything. And DSD fundamentally, I mean, the work by Christian Coachman was groundbreaking at the time. But fundamentally, it's like a visual wax up. And if you want to get a bit more involved, you turn it into some sort of 3D model. There's a lot of different courses that really benefited us with the smile design process. I mean, obviously the stuff that Christian Coachman does himself is incredible. The other things is just trial and error, really. There's a lot of smile designer applications now. And if you just want a 2D motivational wax up to show a patient, that's not really hard to do. You don't really need a course as such. You just need to learn how to use the software, but it's kind of translating that to a 3D model that you can eventually transfer into the patient's mouth, which requires a bit of work. But it's all interwebbed. I mean, then you're learning about how to use CAD software and all the, the fundamentals of, anterior aesthetics, and it all relates to your full mouth rehab stuff, because generally when a patient spends 30, 40, 50K on their teeth, the least you can do is give them a nice smile at the end,
Yeah.
So it all kind of bakes into itself, and that's kind of the beauty of dentistry, is that the more CPD you do, the more you realize it's benefiting other aspects of your dentistry. For instance, this implant course I did, well, it opened a gate for me to be able to do wisdom teeth and take out wisdom teeth. Obviously, case selection is key. You start off with the low-hanging fruits and you slowly build up your confidence until you can do bigger cases. And the really hard ones, you refer to a specialist anyway. So it's all interweb. This smile design is, anyone who's interested in doing any cosmetics these days or cosmetic dentistry should be getting into smile design. It's a no-brainer. And even if you're doing the rehab stuff, smile design is part of it, because, again, anterior cosmetics.
Right. So are you saying that you kind of pick these kind of courses along the way because of the patients that you were kind of coming across, or is it more that this is something that you were more interested in and you want to dive into more?
I would say both. I'd definitely say both. I mean, you get to a point, like, for instance, everyone gets these patients that have a dentulous space, and you get to a point where, partial dentures aren't really that amazing. I think anyone would agree on that. And then your only other tool in the toolbox is a bridge. And so you get to the point where you want to offer your patients something else. And rather than lob them out to a specialist or another dentist, you get to the point where you're like, look, why can't I do it myself? And that kind of guides you in that way. And the same thing with your wear patients. I mean, a lot of dentistry, I feel, is especially new grads. A lot of new grads these days actually have pretty decent hand skills, to be honest. Like, they cut preps really nicely because it's drilled into them. But with new grads, what I find is the main thing that's lacking with them is that they don't know what they don't know. So they don't know how to diagnose that someone needs a full mouth rehab, even though it's really obvious, like severely worn teeth and things like that. And you just get to the point where you want to offer your patients more. And don't get me wrong, I'm like anyone else. I mean, I look back, my first minimum 2 years of dentistry were brutal, just like anyone else. I mean, we all went through that.
Yeah.
I remember my first molar endo. I mean, I love endo now. I do it almost every day, at least once or twice. My first molar endo in private practice was a perforation. So it was a trial by fire, So we all go through that rough period at the first year or two where you're just trying to find your footing. But then it's almost like a boredom thing. You kind of get used to doing single unit crowns, and you get used to doing endodontics and that sort of stuff. And it's like, what's next? I'm one of those people that always likes to challenge themselves and look for the next challenge.
The new frontier, hey?
The new frontier.
So, we're talking about all of this, and then so in the whole scope of things, your dad's pretty heavy into this whole digital dentistry side of things. At some point, you guys were pretty early on in getting E4D cameras. I think your mom was pretty heavy on buying that really early to get your dad into it, I heard.
Yeah. It's a funny story. Eh? My mom was actually the main part of this whole thing that started, almost resulted in the Institute of Digital Dentistry, in that my mom and dad are dentists, and they don't work together, which is kind of funny. That's a whole story for another day. And she was kind of pushing him to get into this digital thing. I don't know what made her believe in it, but so my dad got an E4D, she got an E4D at the time, and anyone who remembers knows that those were terrible machines, man. Oh God, like, not just E4D, just anything in that generation. It's like comparing a Nokia to an iPhone. and it's quite funny. My dad persisted. He didn't enjoy using this thing, and he spent countless hours after work trying to get this stupid thing to work. And he always tells me a funny story. He got to a point where he called up, I think it was Shine at the time, who was distributing it. And he called them and he said, look, just take this bloody thing away. Just come to the office. I don't even want my money. Just take this like demonic thing away. And they wouldn't, and they tried to do a bit more training, and like with perseverance, he kind of got the hang of it. And it's like you look back, and now digital kind of dominates everything we do. It's part of every single thing we do, which is kind of mind-blowing to think.
Yeah, I mean, to think that, your dad, who was like totally like, no, I think I'm good without it, to changing over, and your mom was just like, no, we're getting it, you're playing with it, and then we'll work off from there.
Pretty much. And the good news is, I don't want to scare anyone off with the digital side with that horror story, but the good news is we're talking about like 4 or 5 generations ago of scanner. And these days, they're a lot cheaper, they're a lot easier to use, and the support is all around you, which is good. I mean, we run a whole bunch of courses, of course, and there's courses pretty much everywhere in the world on these things. So, yeah, not like back in the day. It was quite brutal because even the rep at the time didn't really know how to use it. It was so new.
Yeah, so I mean, so your dad's kind of going through all these ups and downs of learning, trial by fire, like as you would say. And then you kind of come into the practice, and then, like you've mentioned, the university hasn't taught you anything about this. And your dad's like, here's the scanner. This is how you use it. And then you embrace it, and you're like, what is this big contraption I'm holding in my hand?
It's almost like I imagine my kids, instead of like a dummy or whatever, they're going to get a scanner or something. I don't know. But like, yeah, look, I came in and Dad's just like, look, you can either do it this way or do it this way, which is way better in almost every way. I actually remember fondly in dental school, I hated impressions. And like hated to the point where, my stomach would sink, because I did my first impression and the patient gagged, and it freaked me out. Yeah. It gave me like a phobia of impressions. So for me, it was almost like, look, I don't need to do impressions anymore. This is great.
So, all right, you're learning it, but obviously it's a struggle. So how do you kind of dive more into your education about this whole digital dentistry? Because it's still kind of early days.
I was fortunate, and look, this kind of ties up to why we started IDD in the first place. I mean, when I got in, I was very fortunate. And I had an amazing mentor, which was my father, which is a key point for any new grad listening or coming up student. I mean, the best thing you can do for your career is find a good mentor. Don't go for the highest paying job. Don't do any of this stuff. Just find someone who's going to invest in you. I was fortunate. No one's going to invest in you more than your own father. So I was working alongside him, and he just showed me the ropes. He taught me. We spent a lot of hours, after hours. He was showing me how to use the scanner, how to design. And it was really, it's one of those things where the more you do it, just naturally, the better you get. And you know what Facebook is like these days. It's like dentistry is everywhere. You can't get away from it. So I'm part of all the groups, and I watch what these guys are doing, how they're designing things. And you're just always consuming information. And by practice and practice and practice, you just pick it up. And it's funny, that's kind of what led to us starting IDD, is that there was just no training. IDD really started because we were one of the first in the country to have a whole bunch of scanners. I mean, now we have pretty much every scanner you can imagine. Globally, I don't think anyone else has the range of tech that we have in a clinic. But at the time, this is back in 2016, 17, we had a CEREC, a Plan Mecca, and a Trios. And it was kind of crazy for people to have all three. And what I realized is that, when people are inquiring about these scanners, you ask one rep and, they're all just doing their job. You can't hate on them, but they all tell you it's the best thing. And how IDD really started, it wasn't courses. It was just me and my dad writing up blogs online about our experiences with these scanners and the pros and cons of each one. So people kind of had an idea of where to go. And that's really how it started. And from there, yeah, it's just, the rest is history.
Yeah. Something that we talked a little bit earlier as well was, associates, they see this digital dentistry. It's on the up and coming. They believe in this knowledge. But, for them, they might be in a situation where they're in a practice that doesn't have CPD. So it doesn't have digital dentistry or these scanners, but they believe in it. We've had one guest on earlier as well who was like, you know what, he went ahead and purchased it, a scanner for himself, even though, like, you know, it is maybe expensive for a recent graduate. But what would you say to that?
Look, you really have three options. I mean, like we were talking before, Lawrence, digital dentistry is not a composite course. You can't just watch something and then start applying it. You need the tech. At the very least, what you need is a scanner. That's all you need to start. And the handy thing is these days they're a lot cheaper. I mean, you can buy some secondhand scanners for about 20, 25K these days. And the Chinese ones are coming soon to the market, which are even cheaper. So really, for a new grad who's sitting there and he's like, look, I want to get into this digital thing, but I don't have a scanner, you realistically have three options. A, you talk to your boss and have a serious chat with him and try to, you know, talk some sense into him about why he needs to get a scanner. Because again, look, if you want me to share some slides about the benefits and the research-based benefits, I can. They're endless now. It's a no-brainer, really. Or two, you buy your own scanner. Now that sounds a bit extreme, but look, if you really love your workplace and you love the people you work with and you're making great money, blah, 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 but you don't have a scanner and you really want one, well, go buy one. Go buy one just like you'd buy a pair of loops for yourself. That's the only other way. And thirdly, which is a bit brutal, was leave the job and find someone that does digital. That's really the only other thing you can do. You can't imagine up CAD CAM without actually having the equipment. So if you're really keen, talk to your boss and try to figure out a way. And I think most people are leaning towards getting scanners anyway. The percentage of people that are thinking of investing in scanners is increasing year by year. And if that doesn't work, buy your own, really. That's the only other thing.
Fair enough. So of all the CPD that you've done, do you feel like there was a particular one that wasn't as beneficial for you at the time and you would do differently next time?
I don't want to throw CPD providers under the bus, because there definitely are a few that ring a bell. I'll spin it this way. Look, one of the key pieces of CPD you can do, anyone, is some sort of communication CPD. It's brutally important, and we do a lot of that in our practice. We do it through prime practice. There's all these other ones these days. You know, what's some of the other ones in Australia? I know you guys have a couple of names for similar guys doing.
We've got Mark Hassad, we've got a few other ones, yes.
Yeah, so there's a few communication CPDs, and what I would suggest is, look, with communication CPDs, I would go for the kind of the longer span ones rather than like the day or 2 day CPD about communication or, you know, planning treatments or anything like that. A lot of the time, you know, CPD is two types. There's kind of skill-based where you can take something home, and there's more like theory crafting where you can kind of try be like the guy who says they're really successful. And a lot of the time it's never a 1 or 2 day approach. You know, these things take years and years. So I don't want to throw anyone under the bus live, but definitely, I mean, a lot of the CPD that I've done hands-on has been super beneficial. Some of these more lecture-based CPDs are a bit hit and miss, I find. Especially with the communication side, it really needs to be ingrained in the practice. There's no point doing a communication CPD and learning how to do 1 hour examinations when the practice is set up for 20-minute examinations.
Yeah. So it's kind of maybe seeking your practice principal and who they've kind of learnt best from. So then you can kind of follow a similar kind of philosophy so that when you attend that communication, you can apply it the same way if you believe in that philosophy.
100%. Yeah, definitely try align with your practice goals. I mean, it's one of those things. A practice is like a machine, and it needs to be a well-oiled machine where everyone's doing similar things. And definitely, look, if you see what your owner or practice or boss is doing and you really like think it's amazing, definitely align with, you know, ask them how they learned. Because communication is one of those things where you'll see so many different providers out there, and they all kind of have their own ways of doing things. I know some dentists that do hour-long examinations. I personally do, and I swear by it. Others are very successful with 30-minute examinations. So there's no one size fits all, but definitely look at the people around you, especially those who are much more experienced, and try to learn as much as you can from them, because they would have gone through kind of the same trials and tribulations you're trying to go through.
Yeah, we're talking about trial and tribulations. Have there been any struggles in your CPD or dental journey so far that some of our viewers don't know about?
Oh, endless, endless, endless. I mean, a lot of the digital stuff was a lot of struggle for years and years and years. I guess for me, again, and a broader spectrum, not just about digital dentistry, it was just kind of gaining confidence. That was the main thing. I mean, like I say, I remember how brutal my first year out is. Or was. It was one of those things where almost every second week I'd have a tricky extraction that I couldn't get out. And, just I can't stress this enough, having a good support circle around you, especially in these times when people's mental healths are taking a beating. Having, a mentorship around you, and I don't mean out of city. Usually the mentorship is best to come from within the clinic. I mean, that's crucial, because look, at the start, it's hard. Dentistry is not easy at the start because there's so much that's going through your mind and you're overanalyzing everything, and then you get to a point where almost everything is I don't want to say autopilot, but that sounds terrible, but you know what I mean. You just get to the point where you're so comfortable with your skills. It's not like that at the start. At the start's a real struggle, and you need someone there to always fall back on. More important than courses is, I stress to everyone, find a good mentor. That will change your career. Find a good workplace. It will completely change your career. And a lot of people feel like, the first few years they could just stick around or whatever. But I would say the opposite. I mean, I work like a dog though, so work-life balance is not really my strongest suit. I love dentistry and that's all I do. But I would say, to be honest, the first few years are the key, because they completely shape the trajectory. If you get those first few years right, in like 5-10 years, you're like the top of your game.
Yeah, it's an interesting point that you talk about. The first few years, if you can get that right, it changes everything. But I guess if you don't get that, it's never too late to make that change, right?
Yeah. Of course, and it's one of those things. If you ever find yourself in a situation where you're not quite fulfilled or satisfied, just reach out to your, I don't know, even to people like me or Lawrence or the guys on CPD Junkie. I mean, dentists are a pretty good community. We all like to help each other. But definitely, if you don't feel fulfilled in your workplace, that's something you need to change. And I see that through some of our associates, to be honest. We have some associates that have worked in some other places for like 5 years, and then they come and work with us, and we're very heavy on training and obviously getting them souped up with digital, and some of them just like flourish like crazy. And a key workplace really can just change your career.
Yeah. I mean, mentoring is a tricky thing as well at times. Some people like to be a fly on the wall. Some people want you to check on them. Some people want you to be leaning over their shoulder. How have you found it? And what would you say to the recent graduates?
You're totally right, Lawrence. And that's a tricky one, because there's so many different styles of learning, especially. And I would just find your happy medium where you feel comfortable. For me, I didn't really like a lot of the fly on the wall thing. What gave me a lot of confidence in my dentistry to start excelling and learning quickly was just having that support person there. And that's how I like to be with our associates. Just having someone always in the clinic where if something went south, they can send you a message and you'll come in and, introduce yourself and take care of the situation, whether it's a hard extraction or a molar that you couldn't file through or something like that. At the same time, look, some people need a little bit more hand-holding at the start, and it's just really finding what suits you best. And don't worry, you're not going to stay in that kind of state forever. In a year or two of just good mentorship, you're going to look back and kind of laugh about how hard it was, because now you find it relatively easy.
Mm-hmm. Yeah.
But definitely, I mean, having that relationship with, I feel bad for some new graduates that get put in practices alone. I think that's ridiculous, but let's not get into that.
Mm-hmm.
Having that relationship with your principal dentist or any senior dentist where, like, you don't feel bad to ask them. There's no hesitation or barrier to ask them. And that kind of takes some fostering in its own sense.
Yeah. Yeah. Well, where do you hope your ideal clinical or non-clinical day to look like in 5 years' time, and what kind of CPD do you want to do to kind of get to that point?
Ooh, that's a good question. Ideally, I want to reduce clinical actually somewhat, because a lot of my focus these days is a lot of the Institute of Digital Dentistry dealings. But if I'm always going to stay on clinical, and if I were to have my ideal day, it would probably be 4 days. And in 5-10 years time, I really hope I'm going to stop doing single surface fillings and single extractions and those sort of things. I really think what interests me, at least, is a lot of the more reconstruction side of things. And obviously that's also what's really financially beneficial for the dentist. I mean, it's win-win. You're changing people's lives and you're making some money on the way. And so ideally for me, I want to build up a patient base where I have a lot of patients who need more of the reconstruction rehab work. Right now it's every month or so, and the consistency is the key. The other thing is getting more into soft tissue grafting. Personally, I'm doing a lot of different aspects of dentistry, but one part I haven't touched on yet, and I really want to get into, because again, it goes hand in hand with almost everything you do. And it's almost like the stepping stone. You get into implants and then you realize, hey, I need to learn how to do sutures better. And you do that. And then, hey, I need to learn how to do soft tissue stuff because it's so important. And that's probably the next step for me in terms of CPD. And also orthodontics. I really want to, again, that's just part of the things where I'm finding cases where not just kids, but adults need braces or some sort of alignment at least before doing some rehab work. And it's one of those things where I want to be able to be the single person that provides all the treatment. I think it makes the whole workflow a lot smoother and easier for everyone involved.
Yeah.
Yeah, that's next on the horizon.
So where are you looking in terms of what kind of the CPD courses are? You looking somewhere in Australia? Are you looking somewhere overseas? Or
currently, I mean, like the orthodontics thing is really easy. I'm looking either between Progressive or Derek, and I think they both have a very good pros and cons. Personally, I am shifting towards Progressive ortho for my orthodontics for two main reasons, and couple of other clinicians who have done it a lot in our practice already do progressive ortho and use all the equipment. So it's one of those things, again, with aligning everyone, because if you have the inventory already there, it doesn't make sense to go and buy a whole set of inventory. The other thing as well is with POS is they have quite a hefty online module again, because I don't see us traveling with ease for a while, sadly. Especially with things like orthodontics, you need to set out years of travel. And with that sort of disruption, I'm really looking at the online stuff more and more, and kind of the guided live learning more and more. With the soft tissue stuff, I mean, it's not even on the horizon, because to me, that's going to be one of those courses where I really need to be there doing it live. And unfortunately, in New Zealand, we don't really have the largest course selection. We're not like Aussies. Yes. So for that, I'm really waiting for things to open up, and then we'll consider that.
Yeah, that is interesting. For a lot of graduates, they come out, they're thinking, I got to get into ortho, I got to get into implants, I got to do all of them together or do it really quickly. But I like the fact that, the way you approach it is, you just approach one thing and then you just kind of dive into a little bit more. And even though, like you said, digital dentistry, you're surrounded by it, and it would have been so easy to kind of jump into orthodontics, scanning and all of that. But you kind of waited until you wanted what you were interested in first before you kind of switched and pivoted.
100%. And I feel like a lot of new grads, they get a bit like FOMO or overwhelmed, or I don't know what it is. You see either people online and all the Instagram dentists posting their amazing stuff and Facebook dentists. I would just say, look, just breathe. Like you said, you do have time. I wouldn't slack around doing single surface fillings for like 5 years. You're wasting time. But definitely in your first few years, I would just suggest get the fundamentals right. Pain diagnosis, putting in fillings that don't fall out or cause, pulpitis every time. One of the key things you need to learn is just pulling out teeth properly, not how they do in dental school. I know in Otago, they told us at the time not to use elevators. Oops, I keep pressing space. Sorry, mate. I'm back.
All good.
Yeah, so just like I would really, to start, if I was going to give someone a blueprint, get the fundamentals right. How to cut a prep well, how to bond well, how to do fillings properly, how to do extractions. And look, if you've got enough patients coming through the door, realistically, and if you're switched on a bit and you have good mentorship, that, to be honest, don't get me wrong, you're not going to do Anthony Mack style composites, but you're going to be at a level where you're pretty satisfactory within a year or two. It's the same skill over and over. If you're taking out 3-4 teeth almost every day, you get pretty switched on after a year of brutal extractions. You kind of learn. So I would look, that's really the key in your first few years. Just get the fundamentals right. Pain diagnosis is crucial, especially when you're doing this other stuff. Like if you're doing a rehab, you need to be super quick at diagnosing where the pain is if the patient gets some. You need to be good at endos. Let's say, look, you do a rehab and patient gets pulpitis from one of the crown teeth. Being able to just quickly finish the endo in like a visit or two with minimal fuss and probably no charge for the patient if you haven't warned them about it. That's a good skill to have rather than freaking out and it derails the whole treatment. So the fundamentals are key, and then just figure out what you want to do. I mean, it's not all about just chasing money and going for like orthodontics and implants because all the big boys are doing it, but it's just figuring out, what do you want to provide for your patients? Implants and orthodontics and all the cool stuff is not for everyone. If you're into the cosmetic stuff, gravitate towards that and pick up some cosmetic courses. Some people are really into the surgery stuff. Focus on oral surgery and wisdom teeth and implants and
go from there. Yeah, definitely. Well, Dr. Ahmad Al-Hassiny, there are so many more questions I want to ask, but that's all the time we've got for today. So thank you for coming on the show. If you could let the people know how they can find you or what's kind of going on in your life.
Yeah, for sure. I mean, you can find me on Instagram at my handle is Dr.Al-Hassiny. It's okay. You butchered the name, but I forgive you, Lawrence. And no worries, mate. And you can also obviously find us on the Institute of Digital Dentistry. I mean, I'm pretty active on socials. I'm sure people are kind of sick of hearing about reviews and all the stuff I post, but definitely look, if anyone's interested in digital dentistry, I think our platform is now basically one of the global leaders in digital education. So go check it out if you're interested, and otherwise find us on Facebook and Instagram.
Well, for all our viewers, if you like this episode, drop a comment below on your favorite part, and don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast.
Thanks, guys.
Thank you.
See you later.